Yes, my name is Punchapon Bunchur. I'm one of the registered nurses working at Smithwick Hospital, Bangkok, Thailand. And I'm also a member of a nurse society and online community for Thai nurses. Sure. One of the roles of registered nurse is being an educator for the patient. It is our responsibility to provide education to the patient and providing them with emotional support as well as a guidance to social support within the community. Usually we begin the day with reviewing the list of the patient and see if we have a new admission to the hospital or the patients who have been recently diagnosed with diabetes. After we review the information, we then evaluate their compliance with the treatment regimen and see what their current health situation is before we approach them and talk to them face to face regarding each individual issues. Now, nowadays, there is with the advance in medical technology and telemedicine, we can actually complete a follow-up with them online. We can conduct a video conference with the patient, so the patient can actually be at home, and we can talk with them, assess their health condition, and provide them with the emotional support and education that they need. Supporting diabetic patients physically is actually one of the major challenges for many nurses. Usually the patient's ability to control their blood sugar level often rely on their understanding of the disease itself and also their adherence to the regimen and adjustment to their behaviors. As for providing an emotional support to the patient, especially to the newly diagnosed patient, they are oftentimes scared since they have just recently been diagnosed with the disease that is not curable. It is our job as a healthcare provider to provide them with the emotional support and to show them that they are not fighting against this illness alone all by themselves, and we're actually there for them throughout the disease process to make sure that they can get through this tough time. One of the biggest challenge as a caregiver for diabetic patient is building up the rapport with the patients and the family members. You always want them to trust you. You want them to be coming to you when they have a problems or when they have a questions. You want to be their go-to person, and they won't be hiding information from you because it is very crucial that they provide them with all the facts and the information you need to know in order to complete a care plan for them, in order for you to actually make an adjustment to the plan of care or make an adjustment to the treatment regimen so that their health is actually improving in a according manner. It's actually quite a story itself. My father was actually diagnosed with diabetes since I was a kid, and growing up I always watched him struggling with the disease process and having him having to change his behavior and getting so many things that he cuts off. The complications and the changing habits oftentimes were so difficult for him to deal with. And at that time, there was not much support group or the advance in medicine or monitoring devices that we have nowadays. So being diagnosed with diabetes oftentimes changed that person's life completely. So that was pretty much all the inspiration I need to actually help to set up my mind and realize myself that I want to be there for a diabetic patient. I want to be there providing support and teaching all the diabetic patients, whether it's going to be in emergency department or any clinical setting, so that they know that there is always someone there providing them with support. Well, before I answer that question, how about let's all of us imagine what's it going to be like. Imagine if the things that you like, the things that you always enjoy eating, or the activities that you always enjoy doing, you can't do that anymore. You're not allowed to do that anymore. Or imagine yourself being told that you have some kind of illness that is not curable, and the only thing that you can do is take medication or change your lifestyle completely. Or imagine the amount of expense you have to go through, you have to spend on each month in order to keep this disease from interfering with your life or having an increased complications. I think those are pretty much enough reason for someone to be scared, and that's what happened with patients who have been diagnosed with diabetes. And for us healthcare provider, as I mentioned earlier, it is our job to be able to be there for the patients, providing them with the guidance, teaching them about the disease process and what can be done. And the most important thing is for them to know that there is always someone like us as a healthcare provider to always be there, providing them with the emotional support and physical support, as well as there are many other support groups out there within the community to help them through to the other side of the tunnel.